Now to what's transpired with COVID-19 in this country. I reckon there are three things we know for certain about the coronavirus pandemic. One is that everybody's been learning on the job, whether you're looking after your family, running the free world, advising governments or treating people in hospital. We've all been learning more about the virus and how to deal with it every day of this tumultuous year. Second, we know everyone's made mistakes. There's not one government leader, departmental head or medical advisor in the world who wouldn't do things differently if they had the chance now. That's the nature of this beast. We've been able to learn from mistakes and the mistakes of others, no matter where they've been made. And thirdly, given all of this, none of us know precisely where this pandemic will end, how we'll be dealing with COVID-19 in 6 months' time or in a year's time or beyond. So with all that in mind, no one can claim to be the font of all wisdom. I, for one, have been opposed to state border closures in this country from the start. I reckon Australia needs to deal with this together behind our closed and quarantined international border. But then Victoria stuffed out that quarantined international border, didn't they? One state let us down when it came to quarantine. It was so bad that at the start of the inquiry into the quarantine mistakes today, we heard that all of Victoria's pain might be traceable to this lapse.
Comments made by the Chief Health Officer to the media have suggested that it may even be that every case of COVID-19 in Victoria in recent weeks could be sourced to the hotel quarantine program.
So the state borders, as imperfect as they are when it comes to communities and how we operate as a nation, well, they've now become a second barrier to transmission. We shouldn't have needed them, sure. But having been critical of states like South Australia closing themselves off, I've got to say now they were right. They didn't trust the other states. They were right not to trust Victoria. I've got plenty of loved ones in South Australia and I'm glad now that Stephen Marshall held firm. Now the ACT has a travel warning out for parts of New South Wales and there's argy-bargy between New South Wales and Queensland about whether the border checkpoints should be moved, effectively shifting the border south to make life easier for people. It won't be happening, but it shows how unsustainable all of this is. We need to get back to being one country as soon as possible. That means getting the Victorian outbreaks under control. But it also means deciding what level of infection we'll tolerate. We know we can't eradicate the disease. We know a vaccine might be months or years away or might never eventuate. So at what level are we prepared to tolerate infections and how are we prepared to live? In the early stages, we were all told not to wear masks because the medicos needed them. But from Thursday, masks will be compulsory whenever people leave home in metropolitan Melbourne or the Mitchell Shire.
So I just remind every Victorian that nurses and doctors wear masks when they're treating you, and I don't think it's too much to ask Victorians to wear a mask so that they don't finish up in hospital or contribute to somebody else finishing up in hospital. I think Victorians will embrace this, and I'm very grateful to them for doing it. It's a small thing. It's unusual, but it will make a difference.
Now, compulsion aside, that's a separate argument, and I'm not convinced it's the best way to go. But the push on masks by Daniel Andrews is understandable. It actually makes a lot more sense than the extreme lockdowns he's imposed previously. He's been the toughest premier in cracking down on these people and these businesses, yet his has been the slackest government in controlling quarantine and outbreaks. No wonder they're calling it the Dandemic. It's actually smarter to talk about how we'll change our lives, wearing masks in crowded areas, personal distancing and better hygiene, looking at how to best protect the vulnerable. It's been clear for a long while that we have to head in this direction. 4 months ago, I shared with you the thoughts of a medical expert who spoke about how masks help to remind us of our pandemic responsibilities for ourselves and others.
The moment they heard about a new novel coronavirus in Wuhan, within a couple of days you saw everyone in Hong Kong wearing a mask. Now, the mask is just a symbol that the people understand how to solve this medical problem. They know what the remedy is, and that is to socially isolate themselves from each other, not touch each other and not touch things that they don't need to touch.
Yep, masks and social distancing, changing the way we live. This is our future. Not lockdowns that kill livelihoods, end social contact, destroy economies and make everyone suffer so that the cure can be worse than the disease. Look, it's a truly terrible dilemma. There's no easy solutions. It's all about least worst options. But from all we've learned so far, here and around the world, we have to learn to live with this disease, not destroy our own communities in futile attempts to eradicate it.